somebody come here and sit. So if you're trying to position your arm, so go ahead and get your hand out flat here. Let's do the left hand. So, okay. So try and get your arm to be at a 90-degree angle here. So how does that feel?
Good.
Feels okay? Mm-hmm. Okay. So now try and do it this way. Do you think? No. Okay. So you'll see a lot of people doing this. All right, and this is hard. So now I'm going to turn you.
It's even harder for her to, she didn't even make her hand go flat.
All right. So now put your hand at it. So does that feel better?
Yeah.
All right. So now you can start positioning your tube. So it's just all about, what works for you. And of course, if your patient can't, you can always adjust the CR to wherever their hand is, okay, to make sure that you're lined up. So who wants to go first? So what's first? FM?
AP thumb.
You wanna?
Sure, why not?
My thumb's broke. Fix it.
All right, I'll see what I can do for you, madam. Let me get cold.
It's better in the car.
Okay, so let me see. She's already where she needs to be. Let me put this in my face so I won't forget it. What was that again?
It's 50 at 4. Right?
50 at
2.5. 2.5.
All
It's locked.
fingers.
All right, so that's one of the questions I had for the shielding. We just put it here.
Yeah.
We don't gotta worry about doing it.
No.
Okay.
Just put it on your lap.
So I'm gonna put this on you now. There you go. Could you hold that with your right hand? Thanks.
Don't forget it's a thumb.
So let me see. First,
So we're not worried about detent.
that's true.
Okay.
Remember, tabletop, so we don't have to worry about.
Is the control
Free
panel
flow.
on?
It is.
Okay.
So take a look here first, okay? And look at where you're at. Yep, there you go.
All right. So table Bucky.
Mm-hmm.
All right. You want me to go ahead and change it on here, right?
It should be
That's
tabletop.
I meant tabletop. That's what I meant to say. You want me to go ahead and change it on here instead of going in there?
You can set it on there. That's fine. Oh.
Yeah, if they give you the choice, all these should be small focal points.
Oh, okay. Okay. 55 at 2.5.
50.
50.
Well, I do 50, I mean,
Okay. 50.
oh, this should be more than enough for a finger.
All right, and go ahead and move it over. Sorry, this might hit you. Anyway. All right.
And if you have like a
just let it
little
go.
kid
It's
you're
cool.
doing this on, don't be afraid to go down to like, 2 or 1.5, okay?
Is the second MCP right?
Here you go. You doing a hand or a thumb?
Thumb.
We're doing, yeah.
I just wanted to open up to see where I was at. Okay, so 40 inches. Let me see.
So remember when you're using tabletop, we're gonna use the tape measure, not the.
If you don't have a bucket. Since it's
It's like one off, I guess. No. Okay. All right. And the central ray needs to be, what is it again? The second MCP joint or the third one?
The thumb. So
there's
it's
only one, there's MCP
Okay.
joint is the
So I'll try my best to try to get it.
metacarpal
Are you able to do like that?
Mm-hmm.
Okay.
So she might have to extend her hand out for this one. It might not stay at that 90-degree. Okay.
And then it needs to, I need to bring this up, right? Or could I
Right.
move the table? Whichever one.
Whichever one.
And then, let's see.
Remember to center your parts in the center of the cassette.
That's about right.
Yep, that looks good.
And then I
So we
would.
just have to adjust the collimation.
Okay, so where would you put it? About all four sides, right?
Good.
Yeah,
too
so
much.
your central
Yourself
ray,
on.
you could probably bring your central ray like right here.
Okay.
So just move the. There you go.
Okay.
Remember, like a penny's width,
Okay.
Yeah, so that right there,
I like
and then
that.
bring it in.
and you need a marker.
Is this a left?
Yeah. Left.
So we're a little off center here.
Yeah.
Okay,
that's
so
fine.
we can kind of just move her over just a touch here,
Yeah.
and then move your light over just a bit, and then let's bring it back. Okay.
So you want it centered with the cassette?
So you want to be centered to the IR, yep, and then you just kind of put her hand.
Okay.
You want it to be. All right. Okay. So that looks good. That's perfect. We love it.
Okie
You love
dokie.
it. Okay.
All right.
Okay. So for an oblique thumb, you're gonna do an oblique thumb, even though that's not on your sheet.
Okay.
Let's just go ahead and run through that just so you know.
Okay.
So you already have this where you want it to be, right? So you just have to move her part into
Mhm.
the.
Okay.
You might have to
And
move
for
the
this
marker
one, it
because
was
flips over.
45-degree angle. And is it this way? Or this way, right?
Right.
Going This way.
Yeah,
So let's see. I'm just trying to.
pretty much. You just
Yeah, she's there.
Yeah, she's there. On this one, all you have to do is let their hand rest because
Oh, and then just move it
naturally it
over.
will go into
Yeah.
the 45. Remember, you want to get all of this and keep a penny's width around everything. And then
Okay.
just get your marker in there. Good.
Okay. And then if you were to do, so nope.
Not
Oh,
don't
just
touch
leave it.
anything.
Don't
Yeah,
touch
that-
anything.
Yeah, that was good.
So then
Okay.
if you're gonna do a lateral, then you just push her thumb up.
Yep.
And that's it.
Wow.
And that's all you gotta do. Okay?
Pretty simple.
Yeah.
Okay.
Don't overthink the fingers. Don't
And
start.
don't go crazy on like getting so close on the collimation
Right.
too. Okay, that you're gonna. Because remember,
something.
sometimes collimator lights are a little bit off.
Mm-hmm.
Right, so you gotta keep that in mind too.
Okay, so second digit. Okay. Who wants to? Do you want to position and you be the?
Sure. That's fine.
Okay.
Okay.
Go ahead and have a seat for me.
All right, go ahead and put your hand up there for me. Are we doing PA?
Yeah, just we'll go right through.
What's the
Second digit. That's the fourth digit.
We're doing oblique.
Second,
right?
remember 1,
Are we
2,
doing
3,
oblique or are we
4.
doing PA?
Well, do the
Second digit
PA.
for the-
Just do the P. We'll go through them all since this takes like no time at all. Because you're gonna have to know these routines.
Mhm.
You're not when you go to comp these things or perform them. You're not gonna perform just the oblique. Since this is so easy to do. Okay, good. I like it. Just make sure we're in a true. You know, some people's fingers, might look a little funny. Just make sure. Yeah. And it's not. Some, and like I said, some hospitals, the radiologists are going to want to see. Don't go down anymore because look, you're less than a penny's width.
I
there.
mean, like, can
Here.
we collimate inwards more?
I want you to come out a little bit on the length here because I don't like no. Yeah. You want at least a penny's width. And remember,
Okay.
a penny's is probably wider than a finger, so you're kind of not you're on the edge there. All right. Some hospitals will the radiologists want to see a little bit of the adjoining fingers just so they can make, they know for sure that was your second finger. If you have just the, one finger, they may not know for sure which finger it is. Okay. So some of them absolutely want to have a little bit of the other fingers. The thumb is, is obvious what the thumb is. I mean, that one, just its anatomy is quite different. So that one you don't have to worry about. But on these ones, and the little one, they might. You just have to ask about that. Generally,
I was
they're.
going to say, for the testing purposes, do you want us to have?
I want you to know what your site does, and you do it that way.
Okay.
Okay. All right. Everyone got that? You understand what we're talking about? Okay. All right. So then go to the oblique. You can go ahead and do it. This is the one we'll be tested on. So internal oblique. Did you go internal or did you go external? There we go.
Okay.
Internal is turning towards your body. External is turning away from the body. No, you don't ever cross your fingers over like that. Just like this.
Oh, okay.
Okay. Try and get it as far as you can on there. And yes,
Bring it over.
right, yeah, right like that.
And then should her hand be a little flatter if she can? Or is that fine?
No, that's okay. Sometimes you can go have them do like bring your thumb under here, relax, right like that. That is the best way to do it if you can. Okay, just have them right like that. Okay.
Okay.
For the second finger. Again, make sure we get that. Bring this back a little bit because here, this one we're centering to where the pip,
Yep.
which is going to be that first joint right there. Okay, that way you have plenty of room to get the whole entire digit in, a little bit of the metacarpal, and have a little bit of room on the edge. Okay.
Okay.
All right, and then lateral.
Oh.
The inner.
Okay, good. All right, good.
Right?
Okie dokie. All right,
So we're just
so
making it more
Just go
All the way out.
yeah, all the
Instead
way
of-
through
rather than
lateral.
partial.
Through
Okay,
lateral.
gotcha.
Yeah.
Okay. All right, so next we are moving on to the hands. So do you guys want to switch out?
Yep.
Here, I'll get it on.
There you go.
What?
Corner.
Not necessarily a literal dummy, y'all. Just
Oh, well, normally I wouldn't have my ring on. Do you want me to take it off?
Yeah, go ahead.
And just bring your sleeve. Have them bring their sleeves up too. And
So this is just the PA.
Yep.
Let me do this. And just a little below.
Yeah, we want to come. You want to at least go past where that prominence is. Remember that word at that time. Okay.
And I would maybe,
I'd go a little bit more. Just come.
I would maybe bring your thumb in
Yeah.
just a touch.
Remember, you need pennies width of light. Okay, I keep saying that. Okay, around all four corners, except for, of course, this one. We can't like chop her hand off and then put the pennies with the light there and say, okay, this and stuff like. There we go. Okay. Marker.
Yeah. So would down here be better?
That's fine.
Okay.
So just be, some instructors will tell you to mark the lateral side of the anatomy.
Mhm.
So if you're marking the lateral side of the anatomy, it would be on the thumb side.
Right.
But, you know, if they don't specify.
Yeah.
And
And the book.
Like, oh my god.
I think our instructor did tell us that.
Yeah, so
Yeah.
if your instructor tells you to see it, if they, so there's two different ways. You could say lateral border of the, image,
Which would be this side.
which would be that side, or lateral side of anatomy, which is thumb side. Okay?
Okay. But really, as long as it's
Marked correctly.
marked correctly,
It doesn't matter.
not in the anatomy, in the image, you're correct. Okay. All right. So oblique.
Go ahead. Finish our series there.
So oblique hand, that's like,
Do it both ways.
yeah, that's like that, right?
Mm-hmm.
You turn your hand to your side.
So also, what makes it a little easy,
We don't have to touch on this one.
when you're doing extremities, just show the patient what you want them to do. So
Mhm.
like, I want your hand like this. I want your hand like this. I want your hand like this. so they can see what it is
Yeah.
they have to do. Okay.
So
So the oblique one, that's the okay, right?
So you want them.
no,
So
that's
that's the lateral.
that's
That's the lateral.
center. Again, we're going to try and center right up around. Now remember, when it comes in through here, it's coming out actually under the third. Okay, so that might look a little bit off, but that's really right.
Okay.
Let's see, everything's on 45. Looks good. Okay. Although I'd rather have this over here like that. Not get that thumb too close to the edge there, okay?
Okay.
All right. And then the other way would be
To have the hands.
to have the hands, and a lot of times I'll kind of go like this.
That's probably the most typical
That's the
one that
yeah.
you'll see.
But try not to like see how her thumb is pointed up like that. So if you can get them not pointed out. Some people have a hard time holding that, and like you see how her thumb is shaking
Yeah,
a little
so
bit.
she would
so
benefit
she is definitely
from that.
this one.
Is that
Okay.
the third metacarpal?
So this way is the other way is the
Yeah, like for
preferred
me
way?
that would be,
Yeah.
because I wouldn't be.
It's whatever, whichever way your patient.
So the central ray kind of goes in between the second and the third.
Yeah.
Because if you look here,
It's
all right,
coming
and you-
out under the third.
Yeah.
If you come in here, it'll come out under that one.
So if you're centered directly over the third, all right, do you see all this light right here? That's really not necessary. So that's why we're kind of here in the center, so it's all even, all equal light. Does that make sense?
So keep it
Yeah.
between the first and the second.
A second and a third.
Second and third.
Yeah.
It's going to be the same on the lateral. When we do the lateral, you're most likely are going to be just off of the hand.
Right. Just a little bit.
Okay. Okay.
So when in doubt, just put the middle of the part light.
In the light. Yeah. Remember, keeping the right amount of collimation. All right.
All right, lateral hand.
Okay, the lateral one is at the center to the second.
Yes, because that's the one that's. But you're probably going to be off center. Okay. So come on.
See, my hand shakes, so I don't know how.
You would be one that we'd have to use a sponge.
Yeah,
with.
you might benefit from the sponge. So there's a little sponge right here. Yep. And then you can just
Sorry, you get this.
rest your.
good.
Yeah.
Not everyone's gonna be able to lay it flat like we are.
Yeah.
Here, let go of your fingers. Okay.
Do it this way. For the lateral.
You can
Okay.
see I don't use these.
Yeah, I don't usually. Okay. You want it all the way up on its side. Okay, you got to get this true lateral. And you hope you don't have a patient you're comping on that has fingers that shake like this. Okay, and see how her fingers are? They're. That's not what you want. You want them touching just like that, just so the flesh is there. Because if that's touching like that, there's not going to be the bones superimposing over each other, right? So either no touching or just like that, okay? Not like crossing over, okay? Make sure that you get that. All right. And then kind of like that. Now see how to get this centered on here, we're not exactly over here, okay? Because what? Most of our anatomy is going this way. So it doesn't make sense to be exactly over here because you're gonna have a ton of light over here and hardly any over here. So, and we can.
Now, does it matter if her wrist is straight or not?
Ideally, we would like to have it straight, but sometimes it's just like, especially with her hand shaking thing, we're trying to get this so you want to try and get it as straight as possible. Most important is your hand being lateral, your fingers being lateral, not being superimposed, and not shaking. Okay. All right, and see how your CR is going to kind of probably come on the inside of that, like right in here. Okay, just so that we. All right, and you could probably collimate a tiny bit more side to side. I wouldn't go any more length to length, not length, side. Yeah. Okay.
All right.
All right.
Wrist. You guys want to switch it up?
Sure.
yay wrist. Because you want it right here, right? The crosshairs.
Mm-hmm.
So could I just
You might
move her
want to-
hand
yeah,
down?
You might want to kind of be a little bit, give her a little bit more. Because remember, when we do the lateral, we need to definitely have that 90 degree. Okay, so
Okay.
we already get them in that spot.
Okay.
And unfortunately, like, see, this table is
Does it go up any?
No, it's hot. It's as high as it goes.
So you can always build them up with sponge.
Like when there's the cube sponges, is the easiest
Like
one.
that right there.
Maybe a
Right
bigger
there,
one.
right there. No, the big one. Because that will be flat and the whole thing will sit on there at the stage.
You guys are together for a while.
Huh?
It's fine.
It's terrible.
And if this makes the hand makes it too high, then what do?
Lower the table.
Very good.
I think that makes it just right.
That, yeah,
That's perfect.
that looks
Okay.
better.
Yep.
Okay.
So once again, if you started from the beginning, you don't have to worry about doing it for the lateral because you're already there.
And then you would collimate it.
You would have to bring this up a little bit more because it's not
Yeah.
40 inches anymore. Sorry.
Oh yeah, that's right.
Very good.
Good call.
Very good call. Okay.
Now, what are you going to do with the position of her hand, her wrist? Remember to get it as flat. There
Oh,
you go,
okay.
right, like that.
I was like, I don't know.
The tent.
The tent.
Put your fingers in a tent position.
So you could.
How far down would you collimate as far as?
I would go not any more than that.
Okay.
Okay.
So you went from like here.
Mm-hmm. So wherever it falls on the other side, and then in the center, as long as it's centered right in there.
So just like that.
Mm-hmm.
Okay.
Well, that would actually come more like right here, like
More?
you're, yeah. See how you're.
Uh-huh.
You don't have to. You can just move this. You
Okay.
don't have to keep moving that around. Okay.
That one does, yes. So,
All right.
Now the other option of doing that would be to go like, just have him grab this.
The edge of it.
Yeah.
Okay.
Now she's got a small hand, you know, so that this is probably better for her. But if you got someone with a longer hand, like might have like super long fingers, or long fingers, they can do. They kind of grab the edge like this.
Okay.
Okay. I think that's what they did in the picture. That's why they're. If
Yeah.
you look in the picture in the book, their fingers are on the edge of the cassette.
Okay.
All right.
All right.
Sorry.
So now we have to do an oblique.
Yep.
Yep.
could do the deer plates. But like you can flip that bucket to go horizontal and you can put them there. If you, but we have the
On this one, this one we don't have to worry about the tent thingy, so just have them like bring their hands straight. So it gets all of these nice in a straight line and everything, okay? Just right like that,
Okay.
okay? If they can't hold that for some reason, then you can like, you know, put the wedge near it or by it, or like maybe just do something like this even, so that
Okay.
you're not, this would be perfect if you have one of these, because then what, we're not worrying about if there was gonna be lines,
It wouldn't be in the
it
field.
wouldn't be in the field, right? So, but the wrist is still supported, you don't have anything in the, you know, potentially causing artifacts, okay?
Okay.
So something like that would be
Perfect.
perfect for who's having trouble supporting it.
And then,
And you can just, again, show them. Yep, it's straight. I straighten it out like that. Some people don't like touching, but I.
but yeah,
So
it makes it
that
straighter
makes it
though.
control. Yeah,
Fingers are
like
gonna
this.
look like they're more like kind of back to a straight.
Well, yeah,
Like-
you just want it straight. Look at that. Not like that.
And then, would you comment more to the sides then? Since it's not as.
You could a tiny bit more, but again, you don't want to cut off your marker. So you know, a lot of this you gotta. I wouldn't collimate any more lengthwise, sideways though. Remember, kind of keep it up right to the knuckle line there. Okay. Okay. That's good.
Yep.
All right.
Okay.
Good. Sweet. All right, and then what's the last one?
Ulnar deviations.
Okay.
Oh, am I doing that one too?
Now this one, the ulnar deviation one. I'm gonna have to-
Well, for the ulnar deviation, you can actually have your patient sitting this way, so that way you don't have to turn the tube. Okay. Because if not, if you had them sitting like this, then you would have to pull your tube out, twist it like we're doing it to cube.
Oh, okay.
So go ahead and put your left hand up there. Okay. So just remember when you do the ulnar deviation, all right, you're always going to angle with the long axis of the arm, so always angle up.
Okay.
So just put a 10 to 15 degree angle on that.
Watch out for your phone.
Okay.
So always angle with the arm. Okay, that's good. Yep.
Good.
Okay, so now what she's going to do is we're going to have you just kind of externally rotate your hand. Just kind of get it in this.
Don't only have them go as far as they're comfortable.
Right.
Don't have them overdo it.
Externally on. Okay, bring it back.
Do you want the thumb like as close to the fingers as possible?
That's fine. It doesn't matter.
Where does the?
So remember, just a little. So you want to be kind of over here. What distal medial to that?
I go like aim for right that spot right there. Kind of that joint there. Yep, right
Yep,
there.
that's good. So now we can collimate this a little smaller. Okay. Yep. Collimate in this way. Alright, that's beautiful.
What do we just want like this
You
part
really
mainly?
just need
So we
this
really want to
right
make sure
here.
that this is, what does it say? Are we at 40?
More no.
Yeah, basically at 40. It's cool. So it might be it might help you to have this out while you're placing your central ray. Alright, but that's it.
Okay.
Ulnar deviation. Simple.
Is this the same technique as the PA wrist?
Yes.
The 55
That
at
actually
4?
sounded a lot more intimidating
Yes,
than
it
what it
is.
was.
I know.
Yeah, it's not.
But just remember, no matter how your patient is, just remember always angle up with the arm. Okay, and if your patient can't move, just move your tube. So just in case they are doing, we'll just show you real quick if they're doing the all on one.
Oh, splitting, you mean?
Yeah. So if we were splitting, say extremities here, so we'll use your 5th digit as an example here. You have the smallest fingers ever.
This
Oh
would
my
be like,
God.
I would do her like
This would be like
50 at
1.
1.5.
I was just gonna say that. My God, let me just bring that down a notch. Okay, so I'm gonna bring this tube over here. I'm sorry, I don't want to hit you.
No, you're fine. You do it. I'm watching it.
Okay. So we want to keep the same concept to be lined up with this part of our image receptor, okay? Because we don't want one finger here, and one finger here. So it's really not necessary to use the lead shielding, the lead blockers on these, because the collimation kind of takes care of it. So collimate, all right, put a little marker down. So what I like to do, so I know, where my last picture was, I'll put my marker here when I move so I know that this is where my image is. Does that make sense? So then I'm going to move the body part over, okay? And then I'm going to do my oblique here.
And try and do it so your middle picture, you're doing 3-on-1, is right at that center. That's what I always do. I go by that. So
Let's move her over just a little bit more. Okay. Alrighty. So now I've kind of rotated her finger up. So now we're oblique.
and with these kind of the finger ones, you shouldn't really have to touch the collimation too
No.
much. Like just
And-
do it the first time and move it across.
And technically you don't have to keep marking it, because if you marked it once, then you know it's a left. So then once again, I'm going to move it over. I'm going to put her in lateral here. Okay. And then she wouldn't be wearing that ring. Alright. And then we would just move it over here. Okay. So now we have one in the middle. Alright.
And do exactly what Kim just did. See how she left the collimation there and she moved the finger over here? So she knew not what not to get into. Right. So there's no way she was going to overlap her images.
Right, because you don't want to overlap the images. So, like the processing, so sometimes they'll come up all funky. Like sometimes your image will come up all black and you're going to have to recollimate it to reprocess the image when you do this. So if you do the 3-on-1 and you get something weird, you just got to like adjust it. Post-processing. So they might let you do this, they might not. So if your hospital is doing this, then by all means, but if not, just do them on separate image receptors.
If you're not sure, do them on separate.
Right.
Okay.
So, was that everything?
That was
Oh
everything.
wow, I went through that pretty fast.
This is an easy one.
So do you guys want to practice some more?